atrium. Okay, so this can result in reduced cardiac output. So this is because of mostly a fast viral pericardium, tuberculosis or radiation therapy, cardiac surgery or connective tissue disorders and malignancy. Sometimes it is maybe due to an unknown causes also. So here what are the assessment in echo means we have to confirm it is constrictive pericarditis initially. Then we have to differentiate constrictive pericarditis from restrictive cardiomyopathy. Okay, and we have to analyze the restrictive causes, RCMP causes also. So need to assess the pericardium, which is thickening, calcification, and evaluate the complications, which is elevated or enlarged, and also pericardial, pulmonary hypertension, pericardial efficiency at all. Then we have to go for pericardial assessment. Here the pericardial thickening. The pericardial thickening is increases or within. Darshini கூப்பிட்டாடி குண்டு. தர்ஷினி கூப்பிட்றா, நீ அங்கேயே கூப்பிட்டு பேசுடி, இல்லை நீ கூப்பிட்டு கொடுத்துட்டு வாடி சத்யா. வாடி சத்யா. உட்காந்துட்டு பிடி, இப்படி உட்காந்துட்டு கூட பிடி, எனக்கு கிளார் அடிக்காமல் இருந்தா சரி. அந்த பெரிய சேர்ல உட்காரு. ஜாலியாக எப்படி கீழே கை வச்சு போடி. ஓகே, அசைக்காத.
ஓகே தானே அப்படி? அப்படியா?
ஓகே. Now we have to assess the pericardium. Here we have to assess the pericardial thickening initially. Okay, the pericardium is normal thickening is about 2 millimeter. If it is increased in thickening or muscle mass get increases means it is about 3 to 4 and above. So if it is presence of pericardial thickening, it is about 4 mm, which resembles the pericardial thickening, and we have to assess both echo and also further assessment means CT, MRI at all, and pericardial motions. Pericardial motions mean movement. So septal bounce or shout or whatever, ventricle filling is early in diastole. So we have to assess the ventricular septal bounce also, and tethering of pericardium, it is major one we have to assess. And pericardial effusion. Pericardial effusion is major cause. We have to measure which is a small or it is increased in number or large in size also. See, this is pericarditis, constrictive pericarditis images we have shown here. Doppler assessment and also in 2D restrictive patterns at all. And chamber size and function. Here the chamber size, which means left ventricular chamber size get dilated, or if it is in normal in size. So it is normal in size means within 5.5 centimeter. If it is dilated, it is elevated up to greater than 5.5 centimeter. And normal or a small cavity we have to assess, and LV ejection fraction also we have to assess. Then right ventricular assessment. Right ventricular assessment means RV systolic function, RV diastolic function, RV size. And atrium side, both biatrial enlargement and atrial filling patterns also have to assess. Then this is the restrictive bounce in septal, pericarditis, minimal pericardial effusions, and also pericardial layer also thickened about 3 to 4 mm. And now we have to assess the diastolic function. Diastolic function in the sense mitral inflow Doppler velocity, inflow velocity, and tricuspid inflow velocity. Mitral inflow velocity by EA ratio. E is early rapid filling with reduced atrial contractions, which means 8.8 to 2 means with elevated filling pressure, and deceleration times also we have to assess. So tricuspid inflow velocity means tricuspid regurgitation, pulmonary artery hypertension also we have to assess. And tissue Doppler imaging, annular reverses, and septal and lateral E velocity, E prime velocity how to find out. Then hepatic vein backward, hepatic vein, which means IVC backward, diastolic reversal flow, reversal present or not, whatever we have to assess. And increased pressure is because of ventricular independence. Then pulmonary vein flow, ESD systolic vein flow we have to assess. Then this is the images for pulmonary hepatic vein flow backward flow, then mitral inflow velocity, then tissue Doppler velocity in for LV systolic function assessment, diastolic function assessment. And here the septal bounce. So septal bounce means shifted towards the LV during inspiration. So which is measured in using M mode or 2D apical 4 chamber windows also. Then respiratory shift, septal shift, which means a Doppler during LV, and it is able to measure in 4 chamber window only. Then global LV longitudinal strain also we have to measure. Then RV function, global LV longitudinal strain, RV function. Longitudinal strain is about normal ranges 18%. Then RV systolic function, TAPC, MAPC at all. See, this is the longitudinal strain and TAPC measurement, RV systolic assessment also present here. Then valvular assessment, mitral valve regurgitation, MR or TR. MR and TR, which resembles the valvular functional MR and functional TR, not for an structurally it does not get affected. Then inferior vena cava assessment, flow reversal, dilated IVC, which means 2.1 greater than 2.1 centimeter, which indicate dilated in IVC. Reduced respiratory collapse also less than 50% or 25% we have to measure. Then pulmonary artery hypertension, which is elevated or normal. If it is elevated means 5, 10, 15, likewise RVSP we have to add it, and intracardiac thrombus. So once the function decreases in contraction of LV, which resembles in LV layered apical clot. So we have to measure proper assessment of LV dilatations, contractions, systolic, diastolic contractions, and clot also. So echocardiographic clue means pericardial thickening, respiratory changes, annulus reverses, which means diastolic flow reverses et al, and hepatic vein flow, S and D wave have to assess, septal bounce, and myocardial appearance, it is important. Then LV straining and M mode, 3D, contrast echo, strain echo will help to analyze more and more. Then standard windows, which means 4 chamber, 2 chamber, 3 chamber, apical 5 chamber windows at all. Then LV global strain, and next thing is IVC dilator, then Doppler assessment. See, this is the patient ECG who having pericarditis and limitations. So complementary imaging means MRA and CT. MRI and CT mostly they are pericardial enhancement for myocardial enhancement, pericardial and myocardial enhancement. Then this is the reference where I have updated. Thank you all.